There is week one.
Okay.
Stella, ready?
Ready. Hello everyone. My name is Stella, and my student number is 230606. And today my topic is myositis and the treatment. So first,
I think it's not
Other side.
sorry,
on the side.
on the side.
There's a point
Left
on bottom.
right, right. Up.
So we're gonna have a brief introduction. What is the myositis? So myositis, from the words you can say, is simply means the inflammation in your muscles. So they have, like, this is a real condition. So a group of the real condition called the inflammatory in your muscles, make your muscle become very weak and tight and painful, and it's getting worse over the time, and it will affect your muscle function, then affect your quality of your life. So they will affect the muscles for you to use to move, like for example your arm, your leg, your span, and also they can affect the muscle around your eyes and around your esophagus and the diaphragms. So now this have lots of different type of the myositis, but today we will just mainly talking about three main type of the myositis. First one, polymyositis, is affect the multiple muscles in your bodies as being inflammatory. So they will it will develop gradually over the time, and it will affect you when you climb the stairs, and then also you feel for standing up after long sitting, and then so lifting objects or reaching over your head, you feel painful for your muscle. And then second one is the dermatomyositis. From the words we can see, dermato is the skin. So the myositis is inflammation for your muscles. So this is the form of the myositis, affect your skin in addition with your muscles. So this disease is developed very quickly, so compared with the other myositis. And then so that means once you do the treatment as early as you can. And also the dermatomyositis is fatal, and in the real cases it will cause certain of the cancer development. And then if this one happens in the children, so it's called a juvenile dermatomyositis. And then the last one is the inclusion body myositis. This is a kind of degenerative muscle disease. Normally happen for the people who are over 50 years old, and this happen for the old age population. So it's very sometimes will affect them to do some precisely task, for example button their shirts, or working, or pick up some very small things, and swallowing, and also for some the other things. So, and for us, we can see what's the common symptoms, because we have already talked about what type of the myositis. So in conclusion, they normally will have your muscle weakness, and you will have your joint pain if it's inflammation happen in your joint parts, and then you will very helpful to you will getting tired easily, and feel like cannot control your arm, your leg, your bodies, and you feel fatigue. If the muscles being inflammatory by the internal organ, some of them, if they happen affect the muscle in your respiratory system, so they will affect your breathing and swallowing problem. If the muscle has been affected in your cardiovascular system, so it will affect your heart. It will have some heart problems. And then also the other common symptom is the skin change. It's the relish on your skin, so which is the this mainly will happen in the dermatomyositis. So you will see the relish on your hand, the skin around your eyes, and then the skin around your back and the chest. So now we comes to why this disease being caused and what's the risk factors. So far, so they have no reason why this disease has been occurred. And then but however, it will some people believe they have some factors around with the genetic predisposition, and some triggers by the environmental medicines has been caused this disease, and also the immunity factor is play a very significant role in this develop this disease. So now what's the genetic predisposition? So it's a certain of the genes they in the it's the certain genes related to the immune system and may contributing increase of this disease. And then also some triggers in the environment they have been might be have caused the onset of this myositis, as also can be. And also if you've been exposed some virus or bacterial environment, and then for example like HIV, so it also can cause the myositis. And if you also been exposed to the medical or chemical environment, it also can develop this myositis, but the evidence is very limited. And then the last one, the autoimmune factors. So the myositis is being called autoimmune disease. So which means our own body immune system has mistaken, has started attacking our healthy tissues, especially for the muscles. So then this around like a lupus, that's okay. The lupus. So this is kind of disease. It's not myositis, but it's also it's autoimmune disease is unknown reason for affect your immune system. So this one also, the patient have this kind of disease more likely will develop the myositis. Now, how we're gonna diagnose? So normally the healthy professional, they can like just being asking you some questions, do some simple physical exam to asking like how you feel, to do some simple movement and motions, and along with some blood test. So the blood test we will checking the muscle enzymes being leaking from the muscle fibers, and also they checking the CK level, which is creatine kinase. Then also the level of your in the blood test. Normally the CK level is quite high. If it's too high, so you will probably diagnose as a myositis. The second one is MIR. So this normally people will professional, healthy professional, they will take a measurement of the detail of your muscle, how inflammation of your muscle, and then the tissue around your muscle. They can identify and diagnose how was the damage of your muscles. And then the last one was EMG and the muscle bicep. So this is people taking part of the tissues of your muscle to the laboratory, and then being research and study under the microscope lab, and as also to see how damage and inflammation of your part of the muscles. So this is the diagnose. Oh, sorry, this is a different one. And then, so then we comes to how we treatment approach to this disease. So mainly the first one will be the medication, And the second one, physical therapy and exercise and lifestyle modification. So we come to the detail of the medication. So normally the first line treatment will be steroid. So the corticosteroid is the first line treatment for the patient, and they will reduce the inflammation and then control the muscle pain and then this is for the things, and then the second one will be inflammation suppressants. This is to inhibit and prevent activities of your immune system, and this is the medicine we can provide. Also the biologic agent treatment for specific. This is for block the special components of your immune system, which has caused the inflammation, and then immunoglobulin is normally is the introvert jobs they doing happen in the hospital, and then this job is taking antibodies and then taking from the healthy people's blood, and then they help her to stop your immune system. So then the physical therapy, we're doing some ask the patient to do more stretching, the flexible exercise like adaptive strengthen your muscle, and then and also develop some strength, some strength. So, and then last one, having endurance. This is also for like doing some working or running to bolster your cardiovascular system. And then the lifestyle modification to ask the patient if they have a rest, if they feel tired, and not be overusing their muscles, avoid the muscle fatigue. And then the nutrition balance is also to support the overall of the healthy of the patient, and the stress management. So the stress is of course very normal now in the daily life. So take the stress out, so it can be help for the disease. And this is the case study. We can see Lisa has been diagnosed with the myositis. So as if this kind of patient has been diagnosed as a myositis, they come to the pharmacy as a pharmacy technician. We will know they've been already prescribed a certain of the medicine, which is prescribed only. So what we can do, just suggest some like lifestyle modification, and then also some exercise, physiotherapy to help with the symptom. If people hasn't been diagnosed, they just feel like painful, like something wrong with them, they come to the pharmacy. We will asking using our technical question to asking how they feel, how long they will feel, how long, and what's the symptom, and then we get the more detail. So we can normally give some OTC medicine like a non-steroidal medicine like aspirin or ibuprofen, but in the end we cannot tell what the disease is. But we're still gonna advise them to go to see their GP to get it diagnosed what exactly the disease is. And in conclusion, myositis is through the medicine treatment, physical exercise treatment, and then a lifestyle modification, this disease can be manageable. That's all. Thank you.
For Stella. Good job, Stella.
Yes.
All right. First time also in the presentation. How did you feel?
I'm nervous.
It did show.
Yeah, I'm shaking.
Are you?
Yeah.
You feel better now?
Yes, released, finished.
All right. Now, being a first-time presenter in this class, you did very well. You also have a very sweet voice. Do you come from the same country? No.
No.
I'm from Burma. And?
I'm from China.
Oh, but the voice is very similar maybe because it's Asian.
Yeah.
But how you say it also is just like a smooth, and just like also in the clouds. I like the way, the tone actually. Very sweet tone.
Thank
and
you.
Carry on doing that.
Thank
Okay?
you.
you know what you're saying. Also, the problem is because there's a lot of technical terms. It's a tongue twister. Okay, but you were able to manage it, but it's okay. Good job there. All right. Little thing when you do your next presentation, take off a lot of wordings. Okay. I saw that there were some which were already bullet points, but there were some PowerPoints which were still definitions. So just make it consistent.
Yeah.
Okay. And then I like it when you had in conclusion, this is what myositis is, and it's treatable. So it is a disease, but it's not really life-threatening, but there are ways on how we can treat it. I like it when you mention that, because if, for example, a person comes to you and then asks for advice, at least you know and you're confident that there's nothing to worry really about, but just has to be self-aware that it might be towards that kind of sickness. My question now is,
Yes.
Are you able to go to the different types, please?
Different type of the
Yes, lupus, those ones, muscles. Yeah, okay. So, among those different kinds of classifications, which is the life-threatening one or the deadliest one?
the dermatomyositis.
The dermatome.
Yeah, because that's
dermatomyositis.
Yes.
Why?
Because this one has been because all of the myositis, this is all known by the immune system problem happen, and then the dermatomyositis, they along with the others different disease like lupus and then the rheumatoid arthritis. So if they have that kind of disease, they will more likely have this, because they all gonna be affected our immune system, so it will be fatal, and then they happen very quickly, and then they also can develop some kind of cancer. Yeah, that's why it's more fatal than the other two. Yeah.
Would it mean that this is late symptoms that you see, and then you already have that? Or can you see it from the beginning that it's already piling up to be dermatomyositis? Would there be stages that, or it's just like, because you said it's fatal, because once you've got it, that's it?
Yes, and then because like this one, it's happen gradually developed,
So
but
it's
this
being
one's
developed,
yeah, but this one is straight away. They develop. They once have you seen the symptom start, and they will develop very fast. So as early you go to treatment or go to see your doctor, as early as better. But this one is more happen like after 50 years old, like the old people. So that's like different.
That's the one with the fingers, just like your arthritis, is it?
Yeah, that.
Something like that?
Yeah, I
Because
mean,
of the
yeah, because
difficulty
you can
of
see some old people, they're very hard to walking, and they're very picking things smaller. So this is like happen because it's degenerative disease, because they happen when they're getting old. Their immune system start to making down, not like a young people. Yeah.
Good. Now, with you've shown some photos earlier. Can you show us the photos?
Oh yeah, that were just this is
Yes.
just dermatome.
So this is just rashes, right?
Yeah,
Are these the
rashes.
common areas that they really
Yeah.
are there to
Yeah.
you know that that's already a dermatomyositis?
Yeah.
No other part except those ones.
They still have the other part of it. I just took three
Okay.
photos. They mainly happen like the hand, and then the people with their eyes, around their eyes,
Yeah.
and then with the chest, and then the back. That's
Okay.
more common. Then also you can have it on the other part of your body.
In your researches, why is it that those are the most common parts? What is in the anatomy of the person that has why this one triggers on those special parts?
They might through like, because it's for your immune system. For my understanding, maybe not right. So maybe the what's called that one? The cassius. the capsules.
Capsules?
No, the
spelling.
Peanut?
CAL.
Callus.
Callus, yeah, the
Okay,
callus
yes.
state mind. Because in your immune system, they have that kind of thing. They can deposit on your skin.
Like the dry skin, the thick ones, is that what you're saying?
Because that one cannot be absorbed in your body. Some like for the extra function they should go or whatever they deposit on your skin. Like then we'll have.
Is it because these are corners of the skin that's why they are more prone to go there?
For my guess,
maybe
maybe, and then and also
it's even here.
Yeah.
You're saying here, so it's
Yes.
like.
But all in all, this is kind of unknown reason, autoimmune disease. So we have no reason why they happen on this part. It just for
And
my
once it's there, it spreads out, is it?
yeah is.
So that would be frustrating too.
Yeah, for some people. So when they have, I saw lots of kiwi in here. They have because their
Is
skin
that
quite
not
well.
psoriasis?
Yeah, I
Something
saw
like
some
that?
people, but also
Or a cousin of psoriasis.
yeah. But this one's also the myositis is very. It's also they have some symptoms very similar as different disease. So you have to be sometimes can be misdiagnosed as a myositis, but maybe it's other disease or maybe other disease. They've been diagnosed for other disease, but actually it's myositis. So that's why people has to be doing lots of tests, and then also,
That's
to
frustrating to
yeah.
the person having this and the family members as well, right?
Yeah.
Imagine the cost it involves and the time that you have to spend for testings.
Yeah.
So it does go to any age as well?
Yes, and the other two type, it can go any age, especially the second type, the dermatomyositis, can go to the children, and then there's a juvenile myositis.
Can I see the spelling, please? Juvenile something?
Yes. These ones can happen for the children. Yeah, that's why. And then these ones happen for the people older age, and this can happen. And then the woman is twice more than the man to having this kind of disease. Yeah.
Okay. Reason why I'm asking is because we've got a staff member whose daughter is having symptoms, that's what you're saying, and she's really having less self-confidence now. She's only 9, but those ones are already on the face. She just started with like a little scratch and then it started to grow. So I might just tell her to go to a specialist.
Yeah.
The mother is really concerned because when they went to the GP here, they can't really tell what it is.
Yes.
And having heard what you're saying, it might be that it can be a juvenile one.
Yeah.
So yeah, good sharing of the item. So at least we could also use it to help other people, just to be aware that because the GP can't even give the right diagnosis.
Specialist. They can't.
And she is frustrated already.
Yeah.
The kid is crying. Why? Because it also spread at the back. So whenever she lies down, she said that it's pain, and then the bed sheets are really like you would see marks of blood.
Oh.
Yes.
It's not psoriasis.
I was asking if it's psoriasis. They said that it's not. And she's 9 years old. So yeah. So good thing that we've got this sharing. So I might as well call her after this session.
Could be related.
All right. So can we have 5 claps to Stella, please? Good job, girl.
Thank you.